Let's start. On the behalf of Alma Mater Europaea University, I welcome you to a webinar of the Ayurveda course at Alma Mater. My name is Tomaž Klojčnik. I am the Deputy General Secretary of Alma Mater Europaea, the accredited higher education institution. And it's a great pleasure to invite the head principal of faculty of Ayurveda course, the assistant professor, Dr. Gordana Marković, to give the main presentation for today. After that, Dr. Picha and Dr. Walter Mölk, who are the representative of the institution who prepared the Ayurveda course, will give also their presentation. Dr. Marković, please.
Dear all, I would like to welcome you to this webinar, in which I will present to you the postgraduate training in Maharishi Ayurveda for the medical professionals at the Alma Mater Europaea University. In the next 15 minutes, I will introduce you to the benefits of studying Maharishi Ayurveda and applying it not only in your practice, but also in your personal life. I will walk you through the structure of the course and key topics of the training. And after the presentation, if you have any questions regarding the course, my colleagues and I will be glad to answer them. Many integrative medicine methods in general, and Maharishi Ayurveda in particular, are gaining more and more interest all around the world. People are looking for a more effective and long-lasting approach to regain and preserve their health in a more wholesome and more natural way. And Maharishi Ayurveda is the perfect solution because it combines thousands of years of experience with the latest scientific and evidence-based knowledge. It is a comprehensive, practical, and time-tested modern formulation of the world's oldest system of natural healthcare that is prevention-oriented, consciousness-based, and free from negative side effects. Thanks to the cooperation between the International Maharishi Ayurveda Foundation and the Alma Mater Europaea University, a new opportunity has been created for those medical doctors and other healthcare professionals who recognize the value and the need for extending and enriching their knowledge and their practice with Maharishi Ayurveda. The postgraduate training in Ayurveda for health professionals will be held at Alma Mater Europaea University in Maribor, Slovenia, from the 2nd of April 2022 to the 19th of March 2023. This one-year-long training that was created by the experts of the International Maharishi Ayurveda Foundation presents an extensive and very effective approach to integrative medicine. During this training, you will learn how to apply the principles and practical skills of Maharishi Ayurveda in your current clinical practice, how to use that knowledge for the prevention and diagnosis and treatment of common diseases, and how to cultivate optimum health. It will enable you to begin a new career or to supplement your existing career with a profound Ayurvedic knowledge. During this training, you will also learn personalized self-care programs, including transcendental meditation, which will help you increase your learning abilities, job satisfaction, and general well-being in your own personal lives. The program consists of 6 courses and has 3 different teaching modalities: on-campus block sets, at-home blocks, and online webinars. The first modality is the on-campus block set, which will be held at the Alma Mater campus in Maribor, and where you will be presented with the core knowledge and skills of the program. Each block set consists of 2 courses, and we will have 3 on-campus block sets lasting 8 days. We will have 8 hours of lectures and workshops per day. And because of the coronavirus pandemic, the previous generation of students had the first on-campus block online, and our experience were exceptional. We hope that during the next year, the situation with the corona pandemic will be much better, and that we will have the opportunity to organize all 3 block sets in residence. We prefer teaching in residence. However, we are completely ready for all options. Our experience from the last year shows that the program does not lose in quality if we combine online and in-residence sections. The second modality are the at-home blocks, which are scheduled in between the on-residence block sets. And at that time, you will be expected to put the knowledge and the skills learned during the on-campus block set into practice on your own. You should have from 105 to 120 hours of individual clinical practice. And this will include the practice of Maharishi Ayurveda pulse diagnosis and the regular daily practice of transcendental meditation. This is a very important segment of your training because during this modality, you will enliven the theoretical knowledge which you gained at the on-campus block set. You will also be expected to go through certain recommended materials and literature on your own. My suggestion and my heartfelt recommendation will be that you start applying this knowledge in your own lives as soon as possible and as much as you can, because by integrating the essential Ayurvedic principles in your everyday lives, you will bear witness to the powerful effects of Ayurveda within weeks. Also, the highest level of support for your future implementation of Ayurveda will come from the positive feedback you will start receiving from your patients as soon as you start implementing Ayurvedic knowledge in your daily medical practice. When your patients start following your recommendations regarding their daily routine and proper daily nutrition, which you will be able to give them after the first block set, you will start receiving their positive reactions within a month. And we have had this experience confirmed many times with the former generations of our students. The third modality are the online webinars, and they last approximately 90 minutes, and they will be held every 2 weeks. At this stage of the course, you will have the opportunity to ask questions and share the experiences you had during the at-home blocks and from the practice with your patients. During that time, we will try to clarify anything that may be confusing or unclear, and you will also present your case studies, and we will look at them together, make comments, and discuss the possible treatment plans. That means that you will have continuous supervision and support during the whole training process. The students from the previous generation didn't stop sending their patients' case studies to me and asking questions about their optimal treatment plans, even in between our webinars. Because of the results and the impact that they could immediately see in their practice, they were inspired to keep on working, and they did much more than what we asked of them. The course ends with the final exam, which will take place at the Alma Mater University in Maribor, and for the next generation, it will be held in March 2023. Basically, this course is created for health professionals who already have medical knowledge and experience in working with patients. You will receive the finest, most methodically systematized Ayurvedic knowledge, which you can immediately implement in your medical practice. And this is one of the unique qualities of this course that differentiates it from all the other courses. Now let's look at the content of the training itself and the specific topics that we will cover. The topics are organized in such a way that you will cover all the important segments slowly and with ease, in such a sequence that with each next topic you will gain a deeper level of Ayurvedic knowledge, which will lead you to a wholesome understanding of Ayurveda and to feel secure and confident in your practice. And during this course, you will learn about the role of the 3 basic Ayurvedic principles, about Vata, Pitta, and Kapha dosha in human physiology, about their function, location, qualities, about the effects of balanced and imbalanced state of doshas. You will be able to understand that the disbalance in each of 3 doshas may cause the development of many completely different illnesses. So the patients could come because he has problem with insomnia and waking up every night around 2 or 3 a.m. But during the exam, you may find out that he is often very angry and frustrated with a low level of tolerance when communicated with others, and that he has heartburn or gastritis or some problem with skin. And after you take the pulse of these patients, you will see that all these problems have the same cause. It is the disbalance of Pitta dosha. And by treating this disbalance, you will simultaneously treat all the above mentioned negative effects and symptoms. This is just one example, and when you know the cause, it would be very easy to give recommendations about diet, about daily routine, about transcendental meditation at the very beginning of your training. Of course, later in the course, you will be able to recommend treatments with herbs, with essential oils, a specific Ayurvedic massage, and many other treatment modalities. In addition to the 3 doshas, we will teach you about the 15 sub-doshas, about their localization and functions in human physiology, and you will see how you will be able to notice these balances in specific parts of an organism by using the pulse diagnosis. During this course, you will also learn about chronobiology, about the daily routine and behavior, and how to best adjust our activities and our whole system to the biological cycles of nature. Also important aspects which we will cover is personalized approach to diet, digestion, and nutrition. And Ayurvedic knowledge enables us to give individual diet recommendations to our patients based on the information from their pulse. These recommendations include when to eat, how to eat, in which environment to eat, as well as suggestions on which types of food to include and which to exclude from their diet. As a very important segment, during our training, we will learn the steps of the Ayurvedic consultation, and the main part of this in Maharishi Ayurveda is Nadi Vigyan. It's pulse diagnosis, a practical and fully teachable diagnostic system that has been revived in, as I said, in Maharishi Ayurveda. We start to learn pulse diagnosis in the first blocks set from the first day, and we will continue throughout the whole training. Each time we will go deeper into the practice, and with time and with a lot of practice, of course, you will increase your learning ability to learn about your patient's state. The pulse diagnosis is the basis and the essence of Maharishi Ayurveda, and allows us to get information about the physiological state of our patient within minutes. Based on that data, we will create a preventive treatment that will contribute to the improvement of the immune system, and the therapy that will initiate the self-healing mechanisms in the patient's organism, which very often removes existing ailments and imbalances. In Maharishi Ayurveda, it is important to understand the etiological factors behind the imbalances, and we will continually put emphasis on their importance throughout the course. During the course, you will learn clinical protocols for common diseases such as gastrointestinal disorders, stress, anxiety and depression, cardiovascular disorders, musculoskeletal disorders, gynecological disorders. You will see how interesting the Ayurvedic view is and how powerful Ayurvedic treatment could be in the case of menstrual problems or sterility or premature menopause. You will also learn about clinical protocols for the respiratory disorders, endocrine and metabolic disorders, skin disorders, and about many other topics. One of the important topics will be Dravya Guna, herbal medical treatments. We will learn about the most important herbs and the form they may be used in, how they are used, how to determine the dose and the frequency of taking supplements, which will depend on the type of the constitution of your patient and the state in his or her physiology at that moment. You will also learn about the use of essential oils, about the mechanisms of their action, about the indication for their application, precautions, and general guidelines for their use. And you will see how we can improve our digestion with fennel or with peppermint oil, or how we can use lavender for skin injuries and burns or insect bites, and many other possible uses of essential oils. And many other topics will also be covered in our program. When I went through my first Maharishi Ayurveda training for health professionals, I remember I felt like I had new eyes. It was like I got the opportunity to gain insight into the problems my patients came to me with, and to understand what is going on in their physiology on a more profound and deeper level. This enabled me to offer a much more complete treatment to my patients that than when I practiced Western medicine only. And I hope and expect that this training will have the same effect on you. The essential support during the whole educational process is provided by the daily group practice of transcendental meditation. And because of that, in spite of the fact that each training day lasts approximately 8 hours with a lunch break and tea breaks, of course, at the end of the course, you will feel that you are much more blissful, joyful, and energetic than at the beginning of the course. And this happens because this knowledge is extremely nourishing and brings us great intellectual pleasure. Our program is specific also because within the on-campus block set experience, we organize events like Ayurveda Day, which are open to the general public. During these events, lectures about the basic of Ayurveda are organized, and our students have the opportunity to practice performing short Ayurvedic consultations, taking the pulse of a great number of people they have never met before, and practicing the diagnostic skills and giving simple and helpful Ayurvedic recommendations. Such an event was organized last year in Maribor with the support of the Indian Embassy in Slovenia, and our course participants were surprised and delighted at their own capability to do this well, which increased their self-esteem and provided them with even more motivation in their further studies and practice with patients. In addition, by organizing these types of events, we also teach our students how to organize similar promotional activities and events in their own countries in order to not only raise general public's awareness about the significance of Ayurvedic recommendations for healthy lifestyle, but also how to present themselves as Ayurvedic practitioners and to motivate people to come to their Ayurvedic consultations. We have a lot of experience in organizing these and similar events, and it always gives everyone a lot of pleasure to be part of these events. Also, we support our students to take part in international conferences, and students from our last year's generation will have their presentations at the international conference organized by the Alma Mater University in March next year. Our last year's generation of students came from 9 different countries, and everyone has been very active and inspired to continue practicing Ayurvedic skills and using the knowledge that they have acquired and to finish their course in March next year. I wish for all of you to experience the beauty of this knowledge and to enjoy your profession on a much deeper and more meaningful level. This training will serve as a very important step in that direction, and we are looking forward to supporting you on this journey. It was my pleasure to prepare this presentation for you today, and now if you have any questions, we will be glad to answer them, and you can make them concise and put in the chat. Thank you very much.
Thank you, Dr. Gordana Marković. Thank you very much. I'm sure you have a lot of questions, but let's hear the chairman of International Maharishi Ayurveda Foundation, Dr. Rainer Picha. Please, Dr. Picha, say a few words to us.
Yes, thank you. First of all, I want to express my joy and fulfillment that all of this is happening in an academic institution, and I want to thank the Alma Mater University and its representative today by Tomaž Klojčnik. And I'm also very happy and proud that the head teacher, Dr. Gordana Marković, is such a lively, as you may have got a sense of it right now, but I have seen her teaching over the last year for the first course of this postgraduate training. And she's indeed very lively interacting with you, and no one, I guarantee, will fall asleep. And it's wonderful to have Gordana as a representative of Maharishi Ayurveda teaching and faculty. And I think this possibility in Europe to study Ayurveda on an academic level is unique. I think there has been only another opportunity in England so far. But so this is really great to have that support of an academic institution, and you receive 30 ECTS, that means the European Credit Transfer and Accumulation System, which means if you continue as an option another course of 30 ECTS, you will then, in addition to the certification of a postgraduate training in Maharishi Ayurveda, you will receive a master degree in health sciences and integrative medicine. So this is, I'm very happy about this, and I would like to inspire all of you. I don't know if everyone has already signed up for the course, but as Dr. Marković has been explaining, and I can only speak from my own experience as a medical doctor, and Dr. Marković is also very experienced, high-level trained Western doctor since almost 2 decades, and to integrate this knowledge of medical Western science with the ancient wisdom of Ayurveda is really so fulfilling, and I really believe this is the future of healthcare in the whole world, because it takes the best of everything that mankind has brought out, and dealing with natural medicine, with lifestyle changes, with natural herbs, and to cure and help people is so fulfilling and so rewarding for yourself and for your patients. So I think you are now inspired to do the registration for the course and be ready for the start on April 2nd, 2022. And so I think this is just a great fulfillment for myself, and don't want to take too long time. I give the word back to the moderator, and maybe Dr. Walter Mölk wants to say a few words before we take your questions, which should be the main part of this evening, to answer any open questions. Thank you.
Yes, please. So Dr. Walter Mölk, the representative of International Maharishi Ayurveda Foundation, one of the founders of this program. Dr. Mölk, please.
Welcome, everyone. It's a really great joy and fulfillment of many years of work that it has now entered academic level, the whole training. We were teaching these courses already since many years around the world in many countries. So this, and have refined it over the years. So you will get a very finished product. And before you can ask question, I wanted to ask you a few questions. When I see in the list of those who attended, a few names I know, but several not. It would be nice if you just quickly in the chat write the country from where you are, and if Ayurveda is something completely new for you, then just write word new or some knowledge or other courses. Because we had also in the last course people who have been trained other organizations in Ayurveda, but it was a great benefit for them, because here in Maharishi Ayurveda we add some additional very precious knowledge. So I wanted to say it's for those who are completely new to Ayurveda, but also for those who have already some experience in Ayurveda. So please let us know from which country you are and if you have experience. And of course, it's for health professionals. So this is also one criteria, because the purpose is that you, in your medical practice, whatever it is, can also be from alternative medicine, that you expand the scope of your medical practice. So you need to have patients, because you have to present a patient's case. So, and if there is doubt regarding the requirements, then we can, on an individual basis, decide if you are suitable to attend this course. I just want to also show a few things. You will get handouts, very colorful, beautiful handouts, will be shown then on the Alma Mater website, on the course materials website. Also, all the lessons will be recorded, so you can afterwards review them as often as possible. And now let's just share screen. Of course, it starts with a definition of Ayurveda, and here are some empty boxes which you have then to guess. And so it's also quite to learn. We start very basic, and then the origin of three doshes in consciousness, and connections to physics, and the five Mahabhutas and their qualities and relationship, main functions of Vata, Pitta, Kapha, connection to Shrotas, Agnis, and Dhatus, and the location, and then the 20 gunas. So it's quite an intensive thing you have to learn, and ideally also you should become familiar also with the Sanskrit terms with time. And then let's say we have here also, of course, diet plays an important role here. What are the effects of the different types of food? Do they increase or decrease the qualities of the three doshas? And as Dr. Gordana has already mentioned at the end, so some protocols, and let's see, we have here, for example, a protocol for Vata digestive imbalance, and then what are the main symptoms, and what spices you can use to balance a Vata imbalance, and what herbal medicine. So this is, and all this handout you will get. And there's quite a huge number of handouts. And also was already mentioned about the pulse diagnosis. We'll start, and what exactly we feel, where do we feel, and what does happen when the doshas move into the body, where do you feel in the pulse. So it's a very useful knowledge, very practical. And we start with self-diagnosis, because first you learn to diagnose yourself, and then you learn also to diagnose this on patients. So yeah, then I think we have now already almost half an hour. So we were thinking to open up for questions, and we will also, forgot to mention, invite several guest speakers to give lessons, Vaidyas and other medical doctors. And overall, it will be a very, let's say, a family atmosphere. And all the CPs will grow together like one family, and you learn together. It's quite a nice feeling in the group. Yeah, so are there any questions? And of course, I assume you have already downloaded the prospectus on the Alma Mater website, and also on the website of the International Maharishi Ayurveda Foundation. Yeah, there you can download the prospectus, has about 20 pages where all the details are mentioned.
Yes, thank you, Dr. Mölk. Thank you very much. Thank you also for your information. You come from all over the world, Serbia, Croatia, UK, USA, also from Malaysia. Welcome you all here. And I'm very happy to have this year student here, Silvia Jelenikova. Could you say greetings to the webinar? Silvia, hello.
Hello, everyone. Can you hear me?
Yes, sure.
Yes.
I'm very happy to be here. As I did this kind of webinar 1 year ago, when I first met Dr. Gordana and Tomaž and everyone here. And my experience with Ayurveda was that I was actually studying Ayurveda before, but I decided for this postgraduate in Slovenia just to kind of refresh and simply to continue studying Ayurveda. I was very happy as I started this journey of Maharishi Ayurveda, and Dr. Mölk maybe doesn't remember when I was asking him on the first course, so what is the difference between Maharishi Ayurveda and Ayurveda? And he explained that this is all consciousness-based. And that was great, that I started to go deeper into really the ancient Ayurvedic wisdom. And I'm very satisfied so far in many elements. First of all, all this knowledge of Maharishi Ayurveda and the whole, I can say, community and the concept that I actually became part of, that feels really like I'm part of something very big and will continue in that. Also, I really enjoy that this is integrating some concepts also from the Western medicine. And I was really blown away by the lecture of Dr. Picha, who showed us how actually the Western medicine is confirming many of the wisdoms by Ayurveda. For example, the microbiome, when now there is really big transformation in the Western medicine, confirming what Ayurveda has been saying for thousands of years, that actually 80% of the diseases have beginning in the gut and have impact on many of the things in our bodies. This year has been very practical as well, and that's thanks to Dr. Gordana. As she mentioned, she's really discussing with us the case studies. And actually, I have started my practice, I can say, this year under her supervision. I gain more confidence to actually go out there and start really talking to the patients, which starts to be in my family, friends, among the colleagues, because I still have another job. And I can see definitely the big results already. So I'm helping them. So it's Maharishi Ayurveda, which is helping them to go on a more balanced way in their lives. So that's really great. The course material, as Dr. Mölk showed, is really wonderful. It's everything is very well created. It's available for us. We can print it. We have great Vademekung, which is a list of the herbal products that we can use and we are using for our patients. So I definitely strongly recommend for you, if you are on this path of this holistic treatment, consciousness-based wisdom and the teachings, I can only recommend.
Thank you very much, Sylvia. Just to add, all the students can have the materials in their e-classroom. Alma Mater is using Moodle. The e-classroom is there for all the materials. All the sessions are recorded so that you can later on study and to regain again the information. So what is the next step? If you would like to enroll to this course, the next course in April 2022, you will have to fill out the application form. The application form can be found on the Alma Mater webpage, ayurveda.almamater.si. Probably you have already been here. You have Pectus also here, and here is the enrollment. And in the enrollment, you have a registration form which is used for application. So you are most welcome to fill out this registration form, and after that you will receive the notification of your application has been accepted. Please, are there any other thoughts from my colleagues at the end to say, or do we have any questions from the audience?
I just wanted to mention, I see now in the chat, we have people from the Lebanon, Serbia, UK, US, Switzerland, Ireland, Israel, Croatia, Slovenia, Malaysia, and Germany. So it's a quite an international audience.
And Austria.
Austria. Oh, yeah. Austria. But, yeah. So it's great. And in last course, there were mainly men, mainly women, only one man. So we will see how will this be in the next course. If we can also
you. There are two men.
Yes.
from France and from Ireland.
And I think we should also mention the fee, because this is also an important point for the people, and how it can be paid in installments, or maybe Tomaž or Gordana, maybe you can mention how this is be done.
Yes, I can do it. The fee is 3,300 euros. It can be usually this year it was chosen by the students to pay in 4 installments. So that's about it. If you wish to learn transcendental meditation during the course, you get a bonus of 300 euros. So your fee will be reduced to 3,000. And if you're already practicing TM, then your fee is at the beginning 3,000 euros.
Jai Gurudev, I have some question.
Yes, please, Miss Kelly.
Kelly, actually I'm from Malaysia, but I used to live in Denmark for many years. I have seen this course last year, but I was a little bit doubtful about my qualification to enter the course, so I did not sign it up. I like to ask because I have quite a lot of experience in this area. I practice already 3 years. I'm actually taking the Ayurveda course from the Institute of Integrative Ayurveda Medical Education from USA by Nancy Nanzoff and another teacher, and then I already finished the advanced, and also clinical aromatherapist from England, and actually I'm an assistant tutor for this aromatherapy course in Malaysia. But I don't really have any like doctor background or any other background. But I'm actually a TM teacher, and actually I'm using this kind of way. I'm actually seeing a client, I don't say it's my patient, every week 3 days, every day about 3 or 4 clients, and I actually give them essential oil as a media to help them, and it's quite successful because in Malaysia we are not easy to get any Ayurveda products, so I can't actually import anything from Maharishi Ayurveda. So I use essential oil, hydrosols, and oil and some other things. And actually I have a mentor behind me, is my husband. He's an Ayurveda doctor, so I actually help him when he sees patients, but I really have no any qualification that I can apply this course, so I like to know this thing.
But you are seeing patients?
Yes, I'm still seeing. Yeah, I'm seeing. Actually, through
so
this
is already one important requirement, and the other we can discuss it. But this is definitely an experience to deal with patients. Yeah.
And are you legally okay to diagnose someone which you have this imbalance and you give them herbs? Is this allowed, or you would get problems in your country if you do that?
In my country, it's no problem.
I think that's the main answer. I think this is fine. The rest we have to handle. It's not ideal to have not the products available that you learn, but there may be alternatives and something locally or something.
Yeah, because I also a distributor for Oshedi, Malaysia and Singapore, so I have quite a wide range of things that I actually describe to them, and it's quite effective. I can say, and because each of my consultation after I give them, I actually talk to my mentor, Dr. Henrik Westergaard in Denmark. So it's kind of like combination that I learn a lot. I really hope to get something from Maharishi Ayurveda in Europe, because all this while I'm getting from USA. So I'm really interested in this course.
Great.
Yeah, maybe Gordana, you have the final word from I
Yes.
think she's qualified, but you have the final word.
Yes, thank you very much. Please send your application. So,
Thank you.
yes.
And greetings to Henrik.
Oh, okay.
I know him from the past very well.
But he doesn't practice anymore. So yeah, he doesn't practice And actually, I asked him last year, shall I join this course? He said, no need, you're already very experienced. So I a little bit doubtful, but I really think I'd like to join this time. Yeah.
We have a question in the chat. After the course, if one can practice Ayurveda, is qualified to practice Ayurveda at the end of the course, and if he gets a title of Vaidya.
No, I think the title of Vaidya that you get at the Indian college only, you are certified as a Maharishi Ayurveda consultant, practitioner. If you're a doctor, you're a Maharishi Ayurveda trained doctor. So it's not a Vaidya. What was the first part of the question?
How are you qualified to practice Ayurveda at end of postgraduate, and do you get a title? No, of course, Vaidya, you need to the Bachelor of Ayurvedic Medicine and Surgery, 5 years in India, but you get here the title of postgraduate training in Ayurveda. And if you continue on Alma Mater, then you get, I think you can get a master.
A Master of Science in Health Sciences and Integrative Medicine.
Exactly.
And as we said, it is basically created for the health professionals. So it is postgraduate. It is update of our knowledge, actually. And for example, in my country, I have a license from my Ministry of Health, and I can open Ayurvedic health institution with knowledge of Maharishi Ayurveda, actually with certificate that I get in Maharishi Ayurveda. So you can practice legally Ayurveda in your country, if a law in your country allow this.
Exactly. The qualification for practicing Ayurveda depends on your country. If you are a medical doctor already and your country allows you to use additional therapeutical methods, then of course you are qualified to use also Ayurveda. But it's from case to case, from country to country. It depends from the country, as I said. And after the course, you get a certificate and 30 European credit transfer points, as Dr. Picha said. You can use them to continue the study at Alma Mater at the master level for health sciences and with the master degree, with the master thesis of health science.
And you also, in addition to the Alma Mater certificate, you will receive a certificate of the course from the Maharishi College of Perfect Health International.
Maybe some good news. Next week, we will have a big event here in Holland, in Roermond. The Minister of Ayush, this is the ministry in India, which is responsible for Ayurveda and yoga, homeopathy, and Unani and Siddha medicine, will come and will officially certify the courses which we are offering at Maharishi European Research University. So this will be, it becomes with a high level delegation of Ayurveda. And so this will be a very interesting and very good progress for us for the work which has been done in the last years, which is now finally also officially recognized by Ayush. When it has been done, also put the recordings of that event online so that you can also then watch it.
Thank you, Walter. Very, very good information about the Congress. Do we have any new question?
Just one question. The course will be online for 1 year, and you have to attend in person for how much months or week, or it's a full online course?
It is not online course. So we plan to have this in residence. 3 times 8 days. You in Prospect you can find the exact dates, and in between you will have online webinars and at-home blog sets as I explained.
And since you are all coming from Lebanon and the US or whatever.
One lady is from Lebanon in this year also. 2 of them are from South Africa. 3 of them are from Ireland. So for you, it's better to be present in Slovenia, and it is possible. First time will be at the beginning of April. Second time at the end of July, 8 days also. You will know exact dates in advance before the course starts. And the third time will be at the end of November 2022, and the final exam will be in March 2023.
Oh, it's okay. It's 4 times
so
presence.
you can organize everything, and
yes.
It's really good energy, and everybody like to be in Maribor.
Thank you. I'm sure. We can find all the details on the website. The courses, how many online, how many presential. They are all in the link, yes?
Yes, in the prospectus. You can find in the prospectus.
There's one more question in the chat. You're mentioning Master of Science in Integrative Health. Is this study covering only Ayurveda? And if not, yes, it's mainly Ayurveda. And if not, can you share more info on this study? Yeah, no, we mentioned integrative medicine, as someone has mentioned. I will speaking for how modern medicine integrates and actually discovers without knowing it's Ayurveda, but science behind modern medicine is often, age-old Ayurvedic principles. And it will be at the end the skill of every practitioner to integrate his medical background together with Ayurveda, but we are teaching Maharishi Ayurveda, not any other traditional medicines or modern medicine or anything.
But in the master, there are also other things required for the student.
Prerequisite, yeah. You need basic knowledge in physiology, anatomy, and how to do research and things. Yeah.
Research, yeah. So there are several other additional areas, and I think it's additional, I think a 2-year study in addition, then you have this master.
Yes, with Ayurveda you get 30 ECTS, the course is 120 ECTS. Another 30 ECTS is master thesis. You can do the master thesis also, of course, if you are studying Ayurveda, you do also the thesis from the Ayurveda content. But you have to finish also the methodology, the scientific methodology in the first year, and some other basic health science knowledges to fill the master course at Alma Mater. Exactly. But you can use this 30 ECTS perhaps on other universities. The European credit transfer system is transferable.
Or Tomaž, if someone is a medical doctor or has some other courses like physiology, anatomy, and sciences, then if you can provide and you don't need to make an extra course, you have it already in your previous study, and that is also sufficient.
Yeah, these courses will be acknowledged to him, yes.
It's only in Middlesex University, and I don't know if it's still active even that they have this, but probably yes, but there is no other academic training in Ayurveda right now in Europe.
And I would say, let's say after we close the webinar and then you say, oh, I should have asked this, then just send an email to whom? To Tomaž or to...
Yeah, there's a contact in the prospectus, I think. professional.training@imavf.org. It's at the end of the prospectus.
There is also a contact form on our web page, ayurvedaalmamater.si. You can also fill out the contact form.
One question, the Maharishi Ayurveda aromatherapy is the same of Ayurveda aromatherapy, or it's different, the Maharishi and or?
It's the same.
The same, okay.
The same Maharishi is from our organization, from the college, from Maharishi College of Perfect Health International. It's a different course on aromatherapy from Maharishi Ayurveda. it's the same organization offering this course. Yeah.
Okay.
But in this course, you will also have a part about...
a part of
Part of it, yeah.
Yes, and what is specific in Maharishi aromatherapy is that we know how essential oils affect the doshas. So we know which oil can decrease, for example, Pitta dosha or pacify Pitta dosha or Vata dosha. So it's really wonderful knowledge. And this is difference.
So I think, Tomaž, if there's no other questions, we may have some closing remarks, and then we...
So let's hope that the crisis will end and the course will be as planned. Otherwise, we'll have to use again the help of online. One way or another, the course will take place and be part of it. It's a very nice course. Are there any final remarks from my colleagues?
I just hope I will see all of you for the next course. Yeah, I hope you are inspired and take this course. It will be a fulfillment for everyone participating.
Thank you very much to everybody. Have a nice evening and hope to meet you again. Goodbye.
Bye-bye.